Today, I'm joined by Dr. Josh Harwood, a clinical psychologist specialising in children's mental health. And today, we're talking about the truth about ADHD and neurodiversity in children. Josh, welcome to The Health Perspective.
Yeah, great. Thanks very much for having me here.
Let's start with a really direct question here, because I think that's what people are here for. Do we think that ADHD is overdiagnosed in children?
Yeah, I think it's a very interesting question and important question. I suppose what we're identifying there is, are rates of ADHD diagnosis and ADHD in children going up in terms of the rates of diagnosis? I think the answer to that is 100% yes. I think if you look at the data over the last 10 years, it's probably gone up 5 or 10 times even. But does that mean it's being overdiagnosed? That's a slightly different question, because we could be answering the question of, are we actually just getting better at identifying it? Is the stigma reducing, so people are getting more kind of okay with seeking support for them, or if their child is struggling? So I think all of those things are playing into why we're seeing more diagnoses. But the other question is then, is it being overdiagnosed? That's kind of getting more towards, do we think that people are maybe attributing things that aren't ADHD to being ADHD? That could be just normal childhood behaviours, or a slightly over-exuberant child? Or is it down to kind of school struggling, increased pressure, just kind of ADHD becoming a catch-all term that everyone is just seeking a diagnosis, and professionals aren't being very thorough and they're just dishing out diagnosis left, right and centre? So those are important parents. Lots of parents who come to my clinic ask me those kind of questions because they might be struggling with their child, or their child is struggling, or they're struggling in school, and they really want to know, if I'm going to go down this route or think about it, is this just going to be a process where you're going to do tick some boxes, just do a bit of a checkbox, and then just dosh out a diagnosis, and then there's no support or thinking or extra understanding that comes from it? So I think it's maybe less important about, are we over-diagnosing or under-diagnosing? They are an important question, but it's a bit more of an academic question. I think kind of clinically, it's about making sure that you are identifying and therefore supporting the young people who really need it, not over-diagnosing and making something bigger than it needs to be if you can support it in a different way. But also, we don't want to go missing young people either, particularly some of those young people that might be harder to identify, maybe some of the girls who really mask, or people who are very bright and able and hold it together very well at school but maybe not at home. Those are the people that might be getting missed, and that can have longer term consequences.
And what you're touching on here is something that's very close to my heart as a GP, and I do lots of work with families and children with various difficulties and challenges, is the idea of catching it early, or early supported intervention. How important is it?
Yeah, in summary, I think it's very important. If there is something going on that a child needs support with, generally speaking, the earlier you identify it, the earlier you can put support in place. The family can understand what's going on a bit more. If needed, the school can understand a bit more. With time, yes, the young person might be able to understand what's going on for them, and that can have lots of benefits, but not when a child is 6 or 7. It might not mean as much to them at that age. But yes, early identification is important because it's got lots of predictors for better outcomes. The main thing that I want to avoid is over-labelling something that might just be a developmental transition. Children develop at different ages, different speeds, in different orders. It's not even just necessarily a uniform. The brain doesn't develop just in a uniform way. Sometimes one bit is developing quicker than another bit, and that can look a bit spiky at certain ages. And then there's a risk of going in too hard, too deep, and going too quickly and going, this is ADHD, when actually in 2 years' time, some of those things might have changed. But if it is there and you go and seek specialist support, knowing that early is really useful, because we want to protect a child's kind of self-esteem. We don't want them going through school being labelled the naughty kid, or the kid that can't sit in their chair, or doesn't concentrate, or is oppositional, and all those things that even subtly start chipping away at their confidence and self-esteem. And that's where an understanding and a support package in place can really help a child and a family.
What I'm passionate about in terms of why I'm passionate about catching and helping children early is the idea of neuroplasticity. And actually, when you're so young, up to the age of 12, 13, kind of your mid-teenage years, your brain is very plastic, which means it's constantly developing. And actually, if a child has various challenges, and this doesn't necessarily we're not limiting that to ADHD and neurodiversity, but if they have certain challenges, but we work with them early to address the challenges and give them the support that they need, their brain is plastic, and actually almost they can kind of remodel and teach themselves how to kind of interact with the world in a slightly different way if that's what they need to do. The difficulty comes if you delay and you wait till they're kind of a teenager or a kind of a young adult, and actually at that point it can be much harder to change our ways. What's your take on that?
No, I think it's a really interesting point. Funny enough, that's actually when I'm talking to parents about this in my clinic, and I'm sure it's probably similar to you as a GP when you're talking with families about this, they often actually worry the opposite. They worry about labels too early on becoming an excuse for all behaviour, and that just means therefore anything goes. They're actually coming to me going, well, actually, is it not kids sort of, they need to struggle, they need to find their way through these things so they can develop the coping mechanisms. Often parents are thinking about themselves as well. I was a bit like this when I was 6 or 7, and I used to go and report and be in trouble, and I never got support because there wasn't support like that 30 years ago, say, and I've turned out okay, and I've just had to learn ways of coping with it. So why would we label this now? Is it just going to make everything just mean that they can just get away with what they want? So it's kind of the parents are coming with the opposite concern. And my response to that is that behavior that you kind of don't want to see is still behavior that you don't want to see. It doesn't just suddenly mean everything's okay. There is still some things that are antisocial or not acceptable. For me, it's about going, your child is great. They've got definite strengths in certain areas, and that will be fantastic, and I can see that. But there might be a handful of things that they're really struggling with, say more so than average. And actually what we want to try and do is avoid the thing that they're struggling with kind of overtaking everything that they're all their strengths, and end up pulling down the whole thing. So and by identifying the handful of things that they're struggling with, you can then, I sometimes call it like putting a bit of scaffolding in place or putting a bit of extra support, where you can then support those specific things so that the things that the child are really naturally good at can thrive and take off. And then that's how you see children really doing really well. So yes, it's about that neuroplasticity, and then you can work together to find ways of kind of supporting a child. But I always kind of reassure parents, it's never my goal just to mean, okay, therefore everything goes. But sometimes a little bit of compassion at certain stages can go a long way as well.
You mentioned labels and labelling, and I'm very interested in your take on where that comes in, because I think there's this dichotomy between some people chasing a label and some people not chasing a label or wanting to avoid a label. And then on the other hand, what I see a lot of is people who are very well intentioned but really, really wanting to get a diagnosis and establish a label for their child, and in a completely justified way, and their child ends up with a diagnosis of ADHD, but the label and the diagnosis becomes the objective. And not a lot of people have then thought about what happens afterwards, because the moment you get a diagnosis of ADHD, nothing necessarily changes overnight. I mean, what it can help with is it can help you frame things, and it can help you understand in a more narrative way why a child may be struggling. But it doesn't actually change anything. And I do meet quite a lot of families where they've received a diagnosis of ADHD 2 or 3 months ago, and actually they're feeling completely broken and completely lost because nothing's changed automatically as a result. Is that something that you find in your practice, diagnosing and working with families?
Yeah, definitely. And I think you've touched on a couple of really interesting points there, because one of them goes back to that idea of overdiagnosing, and you do get a certain kind of family where it does slightly feel more like you're chasing a diagnosis, like we're doing it, something's been going wrong for a while maybe, and sometimes it can be like after a really bad set of exam results or something happened, and suddenly it's like, oh, okay, we need a reason for this, and therefore we're now going from professional to professional, looking to try and get diagnosed. And lots of parents worry about that. My experience is that's the real minority.
Yeah.
Most parents in the long run have been struggling, even if they come to seeking a diagnosis later or earlier. It's usually because if they're coming later, it's usually because they've been really trying to manage this just sort of in-house for a long time. It's a real minority of people who are just, we kind of call it diagnosis shopping sometimes. But on that, I think lots of people do worry about that because they hear the stories of misdiagnosis rates going up. They're kind of going, they almost feel a bit of like guilt. Have I failed as a parent? If I'm having to seek this diagnosis, does that mean, am I now just one of those parents who's just trying to make excuses for bad parenting?
Or misdiagnoses. Am I a parent who's going to miss a diagnosis in my child and not support them in the right way? If I take them to the wrong professional and that professional doesn't diagnose them and they do have ADHD, that can equally have implications, can't it?
Yeah, exactly. And because what you really importantly touched on is that a diagnosis without any kind of deeper understanding, because a diagnosis is just a list of behaviours that you've seen, and you've got to do it in a really thorough way, and it's got to be long term, and you're got to take into account lots of different things that might be going on. But if I just then lump you with, that is ADHD, I call it the diagnose and dump. And it's something that I'm really, really strongly against. The idea that you go, right, here's your diagnosis, here's a book, good luck, off you go. Families then come back 6 months, a year, 2 years later, and nothing has changed because, and I say
things
that
have worsened.
Sometimes, yeah. And I kind of say, it's really like the getting a diagnosis is the starting point. It's not the end point. Actually, hopefully with families, it gives us a framework for understanding what's going on for the child. Importantly, it allows us to see the world through the child's eyes a little bit more. This is why you're really naturally good at this kind of stuff, and this is why you're thriving here. But this is why you're finding these kind of things a little bit more overwhelming or a little bit more stressful. And we can put some things in place. And sometimes a diagnosis helps. We have to pair what we know about the child already, because there's temperament, there's personality, there's age, there's gender, there's life circumstances. There's so many different things that are going on. Potential neurodiversity might be one part of that puzzle, but it allows us a bit of a framework for understanding what's going on. And I say when you start with a really good and detailed, thorough assessment that builds up a profile of what's going on for the child, the diagnostic label might be 1 or 2 lines in there, but actually it's the profile of what's going on, and then a really good support plan can flow from that's more targeted to that child. Because often with parents, I tend to find if there is neurodiversity going on, ADHD or autism or something like that, and you just do the regular support, whether it's kind of therapy or parenting support. Lots of parents tell me they feel like they've been banging their head against a brick wall for years. I've tried this, because actually they haven't really understand what is triggering their child and why. And some of those things can be quite subtle. And once you understand what's going on, you have specialist support, things tend to get better quicker.
So you've touched on diagnosis, and I think one of the most challenging things about ADHD in children and adults and neurodiversity in general is when I think about the other medical conditions, many other medical conditions that I as a GP diagnose, there are black and white tests for those conditions. There can be blood tests where if it's positive, you have a condition. If it's negative, you don't. There are scans where if it's positive, you have a condition, or there are certain findings, and if it's negative, you don't. The difficulty with neurodiversity is that the approach is very nuanced, and it is possible, correct me if I'm wrong, to go to 2 different qualified specialists and get slightly different outcomes. So you are an expert in diagnosis of ADHD in children. So just talk me through at a very top level what's involved in that diagnostic pathway.
Well, yeah, and I think what you're touching on there is a thing that lots of parents talk about, is this idea of, is there a confirmation bias going on in there? If you just go looking for something, are you just naturally going to find it because you're asking the right questions and the answers are going to be there? So even if we're not sure what's going on with our child, if we just bring them to you, you're just going to find they've got ADHD, don't you? Because you find it in everyone. And the truth is, there are some clinics out there where that is truth, because there's a little bit of, and it's a bit unethical, but then you can sell certain treatment packages, or you can do so. They would be maybe, and I wouldn't go as far as saying that anybody would deliberately misdiagnose, but there might be an erring on the side of, well, let's give a diagnosis because then we can do X, Y, and Z, rather than it being very objective. But you are very right in that, and I say this to parents who are coming to see me, or a teenager, if I'm explaining it to them directly. It's not a blood test and it's not a brain scan. It's you've got to look at these things in a really, really kind of nuanced, and that's why it's so important to go to a specialist team who really understand it, because with NHS waiting lists being so long and there being quite high demand for wondering if the ADHD is part of the picture, there's all of these clinics popping up now that are doing these almost like quick online checkbox type. And if you do a tick box type assessment, it's going to go yes, 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 no, yes, 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 no, a few ticks, pop out a diagnosis, yes or no. Everyone's wondering if that's kind of valid, and because what you're really getting to is, I want to find it if it's really there. I don't want to just label something that might just be a transition period or something else, or a mental health condition or something like that. As a top level understanding of kind of how a really good quality ADHD assessment, it's important that it's done often with multiple professionals. That's not 100% essential, but I tend to find it's more robust when there's a few different people looking at it, or if there's one clinician involved, that they're also discussing it in what we call an MDT, a multidisciplinary team, where there's different professionals thinking about, could this be better explained by, you have speech and language therapists thinking about the language side of things, occupational therapists thinking about the sensory and occupational side of it. You might have a psychiatrist in that team. You might have a psychologist in that team. They're all thinking about your child, but from slightly different angles. You definitely want to do a really good quality developmental history interview with the parents. So that's going back, because for ADHD, it's a neurodevelopmental condition. So it's something that has been present since quite a young age. And there are specialist tools, more objective tools that you can do, like set interviews that kind of make sure you're tapping into the right areas, and it's consistent between different people, rather than it just being it might feel like a free-flowing conversation, but you want to be hitting certain points. I would definitely be wanting, as long as the parents give consent, I want to be getting lots of information from school, because that is a really, really crucial side of it. And we always meet the child face to face where we can. And actually in our assessments, this isn't necessarily diagnostic, but we always do a comprehensive learning assessment as part of that as well, because I think how the child processes information, how their memory's working, their different skills, their verbal versus their non-verbal, you can learn so much about how a child's brain is working from doing these more standardized tests that thousands of children have done. So whilst the learning assessment is not a core part of an ADHD assessment, we find it pretty invaluable.
And what about age of diagnosis? Because this is something I see, and it makes parents, certainly families I work with, it really anxious. And that, there's a 2-year-old child comes home from nursery, and then a supervisor has said to the parents, they've been really hyperactive, you need to get them assessed for ADHD. And to me as a GP, I get very angry at that, because my knowledge, and please correct me if I'm wrong, is that ADHD can only be diagnosed from, more of a kind of just a preschool age. So what is there? Is there a absolute age cutoff? And, how does age inform your ability to diagnose ADHD?
Yeah, it's a really important question. I think something that lots and lots of parents are wondering, because they're noticing stuff very early on. Often they tell me later on, like they were like this since they were 1, they were like this since they were 2, they were like this since they were 3. Can I just have can I get them assessed now? Because, and often coming from a really kind of caring, if I know early on, I'll be able to support them a lot more.
The motivations parents' motivations are good, aren't they?
Yeah. Their intentions is always with a good heart. It's not to go, I just want an excuse to, so that they can get extra this or extra that. It's often because they just want to support their children. And then it's a conversation about, okay, when and if and when is the best time for doing this kind of assessments. And for different conditions, different things that's going on, you can do them at different ages. So for example, if a parent was concerned about autism, for example, and I know we're talking about ADHD here, but autism assessments, you can actually do really good quality, reliable and robust assessments with a specialist team from age 2.5 to 3, as long as you're doing all the right things and you're speaking with nursery or preschool and you have enough evidence. There are reliable tests. But with ADHD, it's a different ball game, because whenever we're trying to build up a picture of the child as a whole, of, like I was saying, like neurodiversity is one piece of that puzzle. With this, we've really got to take into account, what would we be expecting developmentally for a child of this age? So if you've got and it's all about then a range, because all children are different. We know that. You get some of these 2-year-olds who will sit there and colour for 2 hours and they're calm, and they'll take themselves off and they'll read a book. And some 2-year-olds are just like that. I certainly know my children aren't like that. If I was to diagnose what looks like ADHD type behaviours in a very kind of stereotypical way, things about the attention and the activity levels and the impulsivity, you'd probably be diagnosing 70% of 2-year-olds.
Right.
Because that's what, and then when you get to 3-year-olds, it's getting a bit less. I mean, I'm making these numbers up, but say 50% of 3-year-olds would be like that. And then 4-year-olds, it might be 30% of 4-year-olds, because as a child is developmentally progressing, what we expect them to be able to do by that age changes. So that's why with something like ADHD, because the ADHD type behaviours in a very broad way can presence in most 2-year-olds, and then you only do those assessments really like in absolutely severe cases, or like when it's really, I don't mean severe, but I mean just in really clear cases. I have done those assessments from 5.5, and the guidelines do say you can do those assessments from sort of 5.5. But ideally, I much prefer to wait until the child is 6, even 6.5 to 7, if things aren't too, but again, it comes back to your point of, if it's really starting to disrupt their education and home life and things are feeling really tricky, go for the assessment earlier, because you want to start getting that support plan in there earlier. But there's lots of benefits from doing it from age 6, because they've been in reception for a bit, possibly into year 1, so they've had a little bit of chance to have that kind of almost like training and expectations, that because it's still very play based, but there is a little bit more of a opportunity to practice, like the sitting there and the not calling out all the time. But I'm just so aware that even at age 5 and 6, there can be a huge variation. And that's why I don't want to overdiagnose, because some of those children by the age of 8 wouldn't be having that stuff at all anymore.
And I think this is the key, such a key point, which is monitoring things over time. Because obviously when you come in as a parent, you're so desperate to do something at that point in time. But there are many things you can do. And so what parents who I work with often find really helpful is they might come in with their child who's kind of 2.5, 3, saying the nursery has said they might have ADHD and we're really struggling with their behaviour at home. And I think one approach is, well, we can't do an ADHD assessment, and then they go home and they feel really frustrated and upset. But there's lots of other stuff you can do. So actually, I would say, well, actually, we could set you up with a child psychologist, not to do an ADHD assessment, but actually to think about the home environment, to think about parenting support, to think about all those kinds of things, to give you the kind of support you need over time. And then, of course, we can continue monitoring things over time, because what you may find is that actually with a little bit of that support, things get easier and things get better. What you may also find is that with that support, things continue to remain tricky over time, and you get to the age of 5 or 6 and actually more and more difficulties are emerging, and that's when you can head towards an assessment. So I think playing for time is really important. I don't know if you agree with that. Yeah,
I mean, I think you've summarised that perfectly. I do agree with all of that, and it's a conversation. I find those conversations really tricky with parents of the younger kids, because they're coming and they're really stressed, they're really anxious, they're worried about their child, they're seeing all of this stuff, and I'm working really hard not to invalidate what's going on by saying, you know what, we're not going to do it's not the right time to do an ADHD assessment. That's not the same as saying nothing's going on, just go away and get on with it for a couple of years. I'm saying this could likely be that, because parents often know, and especially if they've got a few kids, like this just feels different to me.
It's the way you say it, isn't it? It's, yes, there's difficulty. Yes, I can see that you and your family need support. I don't think the best thing to do right now scientifically is an ADHD assessment, but here are the ways that we can support you and help you monitor this over time, so that everyone feels confident that we're not going to miss a diagnosis in the future, if that's kind of what's going on.
Yeah, and that's actually what then parents end up doing, because we can set them up with, there's particular psychologists out there who specialise in working with parents, and sometimes I say we can do this, like you can go on our ADHD course, for example, like if you're doing it independently or privately, it doesn't matter if you've got the diagnosis or not. There's going to be so much useful stuff that you can learn, just in terms of like parenting strategies, things like that. Or maybe you want to work with a child psychologist who specialises in working with parents. With a 4-year-old, am I going to send a 4-year-old to sort of talking therapy? That's probably not going to be effective. But you can do things more like play therapy, because it's often ADHD is often associated with other things as well. Parents are coming saying it's the anger or the explosiveness or the sleep difficulties. There can be there's all those the oppositionality, things like that is often what's packaged up when parents are wondering if it's ADHD. So you could see a play therapist, you could work with a parenting specialist, and often that does happen. They do that for a couple of years and it makes life a bit more manageable for those few years. And then they come back or we stay in contact and we say, well, let's have yearly reviews or whatever. And then when they turn 6, they're like, you know what? This stuff actually is still really there. And sometimes it's even getting more noticeable because now we're seeing their peers are getting more able to do this stuff. So actually it's even getting more noticeable, or it's not getting more noticeable. They are developing their skills, but it's still just not, we still feel like there's something more going on here. And then we can go, let's do an assessment because that will help us develop more specialist support plan. But they've had a good go at kind of supporting things beforehand, which is really important for parents.
What's the best combination of treatments or support? Because obviously, I come in it that there's a very medical perspective and there's a very good evidence base in children amongst the use of stimulant medications for ADHD. But there's also a huge role for psychological therapy, which is your area of expertise. So what's the mix kind of? How do you approach that decision and how a child needs support? Yeah.
And it's also, as well as there being an evidence base for it, it's got to be very parent-led and child-led, ideally. Well, not even ideally, it's essential that the child's got buy-in. But obviously, depending on the child's age, there's going to be slightly more parent influence or slightly more child influence. If you're sort of a 16 or 17-year-old teen, you're going to maybe be slightly more influential than if you're a 6 or 7-year-old child. But essentially, what we're getting at is medication useful? Should I be doing that just by itself and not anything else? Or actually, do I want to try and delay that as long as possible and try everything else first? Or in terms of like psychological support, parenting support, behavioural support, ADHD coaching, whatever you want to kind of call it. And actually, what the first conversation I have is that parents have really different. You get a parent coming in who's like, no, I'm really, really kind of don't want to do medication. I really want to understand and support the child. The assessment is important. I want to do everything in my power to avoid having to use medication. So set me up with all the, let's work with school. Let's work with us as parents. Let's work with the child. And I'm really on board with that. I mean, bearing in mind, I'm a child psychologist, a clinical psychologist. So the medication is not my side of things. So that's much more kind of what you do and what a psychiatrist might do. So I'm all on board with supporting all those things. But both from the evidence-based and anecdotally, I've also seen how much the medications can help. Now, I want to make sure that is definitely not medical advice because it's not my area. But having worked with lots of families, the combination of the two can be so powerful. The parent, or not even just a combination of the two, it's parenting support, working with the school, working with the young person individually, especially if there's other things going on as well. If there's real anger issues, or there's anxiety, or there's low mood, all the things that we know can commonly come with ADHD in the long term. Work with those things, but lots of parents do tell me, with the smaller dose as possible of a ADHD medication. There's different types because there's stimulant medications, there's non-stimulant medications, as you know. The parents tell me it can be really effective. But what's been your experience?
It sounds like the way I describe and the way I talk about certain mental health conditions, in that, I say that there's lots of people out there to promote a one-size-fits-all approach. That this, if you do this, and ADHD is not a mental health condition, but comparing it to that analogy, I think, we see a lot that, if you just cut out sugar, your child will be, the ADHD symptoms will improve. If you start, they need to be on Ritalin, they need to be, or avoid medication at all costs. And I really try and steer people away from those one-size-fits-all approaches, because in my significant experience, they just do not summarize everything, and usually it's a combination of those things like dietary modification, psychological support, medication, working with the school, that come together, which form this kind of toolbox which works for that particular child or person.
I've got a quick question for you as well, because I think this is something that parents ask me all the time, is where does it work for a GP prescribing those kind of medications versus other professionals? How does that work in terms of if a parent came to you with a diagnosis of ADHD?
Genuinely speaking, I think we're very generalist, and we cover lots of different areas, and we develop specialist interest areas. And I'm very comfortable working with families and children with ADHD, but initiating medication for ADHD, and specifically stimulant medication, is a specialist area, because there are some very rare potential side effects, and therefore that would always be done under the supervision of a child psychiatrist. Josh, this has been incredibly enlightening for me, and I'm sure everyone watching. If I could finish with one question, that is, if there are parents watching with children with a diagnosis of ADHD, or who are currently struggling and they are considering kind of approaching a diagnosis or thinking about going to get an assessment, what's your one take-home message?
I think my one take-home message would be and I'm hoping the world is moving away from this, but the idea that ADHD is a deficit, even though it's in the names, and the names will be changed in the next handful of years, I'm confident of that, but it's the ADHD, the Ds, it's a deficit or a disorder. I completely don't agree with that. And then I think that actually puts lots of parents off seeking support for a child who might need it, because they're like, well, now my child's going to be labelled as having a disorder or a deficit. I would say it's a difference though, but it also can lead to such incredible skills and talent, and the child is still very able and amazing, but it's about working out the differences of how their brain is processing information, understanding the world, how they're feeling in their body, all those different things that could be going on, because then you can have very targeted support to make that bit of their life a bit easier, and then the bits that they're already thriving and they've got their superpowers, they're allowed to be superpowers and not just be squashed by the whole thing. So I would always encourage seeking support as early as you can from a specialist. That doesn't necessarily mean diving into a full diagnosis, but seeking a specialist who knows about these things, even just for an hour or two, to meet you and your family, to have a discussion about whether it could be a useful pathway to go down. But don't be worried about the labels, because the labels I don't like the names of the labels.
And that's a really useful thing to hear from someone who is literally an expert in providing those labels, or at least diagnosing children. Josh, thank you so much for joining us.
No, thank you very much for having me.
It's been incredibly helpful.
Thank you.